Surgical extraction of tooth involves removing tooth by making an incision in the gums. Wisdom teeth are most commonly extracted surgically. Wisdom teeth, third molar teeth, most often erupt between the ages of 17 to 25. Sometimes the jaw is not big enough to accommodate the last molar. As a result, these teeth erupt at an angle or fail to erupt fully in the mouth and get trapped under the gum and bone. In such cases, you may experience symptoms of pain, swelling, redness and bleeding of the gums, headache, occasional difficulty in opening the mouth, or even an occasional swelling of the lymph nodes in the neck. In many cases, there are no symptoms experienced. Your dentist can diagnose an impacted wisdom tooth by detecting the swollen and tender gums and signs of infection around the tooth. However, your dentist will confirm this diagnosis after taking a radiograph of the region. In cases where the tooth is infected, your dentist may prescribe antibiotics 3 to 5 days prior to tooth removal. On the day of extraction, you will be injected with local anesthesia to numb the area. The dentist then makes an incision on the gums to open up the area in order to be able to visualize the tooth completely. The tooth is then either lifted up from the tooth socket using dental instruments called elevators or luxators, or it is cut into pieces with the help of a drill to facilitate easy removal. This decision is based on the angle of the tooth in the mouth and the extent of eruption of the tooth in the oral cavity. Once the tooth is completely removed, the dentist will stitch up the gum tissue. These stitches may either dissolve with time or may have to be taken out at the dental office after 7 to 10 days, depending on the suture material used by the dentist. In most cases, the recovery period lasts a few days. You must take the painkillers as prescribed by your dentist. In order to speed up the recovery, you must follow the following instructions. Bite gently on cotton gauze pads for half an hour immediately post-extraction to stop the bleeding. If the bleeding continues even after 24 hours, contact your dentist. The effect of local anesthesia may last for 2 to 3 hours post-extraction. Be careful not to bite the inside of your cheek or tongue while that area is still numb due to anesthesia. Do not lie down flat after extraction, as this may cause bleeding from the extraction site. You can use an ice pack on the outside of your cheek occasionally for the first 24 hours. Try to avoid any physical activity immediately after extraction. Eat soft and cold foods the entire day after surgery. Do not spit or gargle or rinse your mouth after the extraction. This may displace the blood clot in the wound and may cause pain and prolong healing. Do not use a straw to drink liquid from bottle, as it may cause bleeding from the wound. Avoid smoking post-extraction, as it reduces blood supply and will prolong the healing. Do not touch the wound with your fingers or tongue. In case of mild swelling on the following day, you can rinse your mouth with warm salt water 2 to 3 times a day.